So I'm going to be coming in. Remember, this is a 34 gauge needle. You want to be very, very superficial, and you create a little bleb right there. Create this. Perfect. And you see a little bit of a blanching effect, and this is exactly how the treatment should be administered. I'm pulling the skin to allow for better penetration, but this is exactly the points in which you would want to inject, creating these little small blebs on her. Now, one of the neat tricks that you have to learn is that you tell the patient to open your eyes. Perfect, because now when her eyes are open, her eyelashes are not really on the eyelid. It may freak her out, but it's completely okay. Stay as still as possible. Very nice. So with the Rejuran I, you are going to be injecting about half the syringe on one side, and then you're going to move to the other side. How are you feeling?
Okay.
Good. Now, for people who are averse to using needles and they want to have the exact same results but with less trauma, you can actually inject it with a cannula. Just make sure that the layer or the level that you're going to be injecting is also very superficial. So you would come in from an entry point, which I would call the RG point. You follow the lateral canthal line. You feel the orbital rim, 1 to 2 centimeters underneath. Here, you just prick it just very, very superficially. You can barely see the entry point, and then you come in. Your skin is so thin. There we go. I place my arrow, which is basically the opening of my cannula, a little bit more on the upper side, and I want to be very superficial. So I'm basically kind of grazing the skin. You can see the tip of my cannula right over there, and that's how superficial I'm going to be. So I place in my Rejuran. You have to be very, very careful. I'm using a 25 gauge cannula, and it will splurt out very quickly. So for those individuals, you want to make sure that you're injecting it very slowly, or else all of it is just going to come out in a bolus. So just make sure that you are going to be superficial. Don't inject if you're not superficial. Your skin is so thin. There we go. Perfect. Yeah, keep your eyes open. There we go. Good. Injecting with a cannula is safe. It causes less bruising, less swelling, and at the same time, I usually tell my patients, if they've got a social event that's happening tonight, that's the way to go. Now, is there going to be any difference between injecting a cannula and a needle? It all depends on schematics. This is the OG of injections, and you get to see, and this is what has been published. So all of the things that you get to see is basically mainly, that's been published is mainly through this type of injection. This, however, is becoming very, very popular and is also atraumatic for our patient. So you can see the differences between the two sides on her. You would tell her that all these little dots that are spaced anywhere between 0.5 to about 2 centimeters away, in this case it's about 0.5, are going to go away in 24 to 36 hours time. That's it.